Hi, my name is Gabriel. I'm going to be your CMA instructor, and today we're going to be going over another medication administration route, right? And so, throughout the series, we've been showing you different routes of medication administration. Today, we're going to talk about putting on creams on our patients, so like a fungal cream, right? So let's get started. Now, the first thing we want to do, as always, is we're going to check our cardex and our MAR. We always want to make sure we have the right patient to start with, and our medication administration is matching our cardex. Same name, same date of birth. Everything looks good here. So we got some generic antifungal cream. Awesome. Now we always use the PIG method. All right, we're going to use the PIG method. So that means that we're going to pull our med from our cart, initial on our MAR, and then give it to our patient. So first thing I'm going to do is I'm going to unlock my cart. My cart should always be locked, and now I'm looking for that antifungal cream. And here it is. Boom. I'm going to apply it to the foot and the toes. Right now, when it comes to antifungal cream, we always have to use a medication applicator, right? A medication applicator. It should tell us how much that we're going to use. Now, before I mess with medications like this at my cart, where I'm going to be putting them into one of my souffle cups, right? I want to make sure that I wash my hands, put on gloves, right? Wash my hands, put on gloves, grab me an applicator for that medication, okay? Now, that's prepared. A generic cream, I place the appropriate amount in my patient cup, that souffle cup. All right, now I'm going to go ahead and put this medication away. Lock my medication cabinet. All right. I'm going to take my medication. Okay. I'm going to knock. I'm going to walk into. And also before I do that, I want to make sure that I put my cardex and everything away. I don't want to leave patient information out. All right, knock. I'm going to walk into my room. Hello, Mr. Cosmo. Could you tell me your name and date of birth? I'm going to double check your arm bracelet. Perfect. Everything looks good. Now I take off those old gloves that when I walk in the room, I want to wash my hands again, put on fresh new gloves. All right, so I just have some medication that goes on your toes, some antifungal cream, okay? If you're comfortable, I'm going to leave you where you're sitting. All right, I'm going to expose just the area that I'm going to be working on. I have my cotton tip applicator and my medication. Alright. I'm going to make sure I get in between all of the toes on both sides. In between and on top of all of the toes. Good. Perfect. All right, now with the rest of this, I'm going to throw this away in the trash can. Throw it away. All right. Now I leave that. I'm going to cover the toes back up. All right. Mr. Cosmo, is there anything else I can do for you? No? Great. I want to make sure you have water at the bedside. I didn't take his call out, so he still has his call out. I take off my gloves, wash my hands, and record. And oops, sorry. You don't have to record a report because we already did that during the PIG method. All right? And then we are free to leave.